Hunger does not cause ulcer, and I'll tell you why. Hi everyone, it's Not Treasure here. You all are welcome back to my page, and on today's episode I'll be teaching you what we call peptic ulcer. Now, what is peptic ulcer? Peptic ulcer is simply like a wound or an open sore that develops on the lining of your stomach or duodenum, leading to pain in your abdomen, bleeding, or other complications. Now, hunger does not cause ulcer. It only worsens it in a situation where one had already developed peptic ulcer. In fact, how exactly does ulcer happen? In your stomach, there is an acid known as hydrochloric acid, which helps to digest the food that you eat. But then remember, because it is an acid, it means that it is corrosive or harmful in nature. But God made it that our stomach comes with a protective layer that helps to protect it from that acid. But then when that protective layer gets damaged, that acid will now start eating into or attacking your stomach lining, leading to what we call peptic ulcer. But then again, what exactly damages that protective layer? Number one is what we call Helicobacter pylori, or H. pylori for short. Now, this is a bacteria that infects or affects the stomach lining, leading to ulceration or inflammation. 2. Excessive or frequent use of painkillers like ibuprofen, diclofenac, aspirin, etc. 3. Excessive production of stomach acid due to things like excessive stress. And then finally, genetics. Yes, some people have some kind of gene that predisposes them or that makes them to be more prone to developing ulcer. Now, how do we then treat this ulcer? Number one is use of antibiotics to treat H. pylori infection. Then 2, avoid frequent or excessive usage of painkillers except when prescribed. Now, thirdly, you have to know how to manage your stress. And lastly, use of proton pump inhibitors. This helps to reduce excessive acidic production. So the only relationship that hunger has with ulcer is that when you are hungry, your stomach will start producing excessive acid, waiting for food to work on. Now, if it ends up not finding any food to work on and you already have ulcer, that particular acid will now start attacking that ulcer that is already developed in your stomach, making you to experience all those kind of discomforts that people that have peptic ulcer experience. Now, if this information was helpful, make sure to share this video so others can learn. I'll see you all in my next one. Bye.